From the beautiful Finger Lakes region of upstate New York, this is the Dental Lighthouse Podcast. We take questions from anyone in the dental profession and discuss what it takes to win not only in dentistry, but in life. Business, leadership, relationships, parenting, health and wellness, money management, nothing is off limits on the Dental Lighthouse Podcast. I'm Jason Tenori, your host, and have over 20 years of experience to pull from. Learn from my mistakes and let me help you collapse time so you can become the best version of yourself. Yo, welcome back. Dr. Jason here, Dental Lighthouse Podcast, and excited about my guest today. Excited and a little nervous, to be 100% honest with you. Dr. Jaffer is here, multi-practice owner from up north, and I'll let him kind of unpack everything that he's doing and a little bit of his bio. But had never really met Dr. Jaffer until a couple weeks ago when I was in Frisco presenting for the Dental Success Summit. And his ideas and his thought process just certainly aligned with mine. And I thought that having him on the show would just bring a tremendous amount of value to our listeners and just kind of very unique perspective on things, and has done some things that some of us kind of talk about doing, but never really can gain traction with. So just thought it'd be a great resource for you guys to kind of have a conversation with him, totally chill, kind of hear what he's doing and how he got started. And then ultimately go from there. So with that introduction, Dr. Jaffer, welcome to the show.
Welcome. Thanks for having me. Excited. I mean, your presentation was awesome when we were down in Frisco, really insightful. And I thought, yeah, it'd be great to chat a little bit more. And this is a cool way to do it so other people can listen into the conversation.
Yeah, no doubt. I appreciate you sharing your thoughts on the presentation, and certainly interested to hear how you do things differently. Before we hit record, you were sharing a little bit about your own way that you handle the new patient experience, a little bit different than ours. And that's what's kind of cool about dentistry. There's a lot of different ways to do it, right? So could you give our listeners just a little bit of background, a little bit about your journey, your elevator pitch, and then we can get into some granular stuff?
Yeah, awesome. So I went to school down in UOP. I'm from Canada, born and raised in Canada, but went down to UOP, was fortunate to do that 2+3 program down in San Francisco. And so at 22 years old, I graduated and came back to Calgary and joined my father, who had a single practice in 2002. And fast forward 23 years, we've now got 17 practices here in Calgary. Almost all de novo practices. So, had a couple join us, but realistically building new practices from the ground up here in Calgary and just growing our, platform through partnership. And so we partner with our dentists. There's no private equity. There's no outside money. Every owner in the organization is a dentist. And most or many of our practices are run kind of 50-50, where there's an ownership portion at the higher level and a 50% ownership with my partner at the clinic level. And so, that's kind of how we've grown the portfolio. And yeah, it's been a good road over the last 23 years.
Yeah, no doubt. That's awesome. We could spend a whole day talking about the inner workings of partnership dynamics and your business model and stuff like that. And that could be maybe another episode, but just at a high level, I'm just really curious, are these locations multi-doctor? Do you have both employee dentists and partner dentists, or are all your dentists partner dentists? Can you just unpack that a little bit?
Yeah, no, for sure. So we try to have one partner per office. That's kind of our ideal situation. Every once in a while, there's more than one partner. The office gets busy or bigger enough. But the idea is to have a partner dentist and an associate, or sometimes a partner dentist. One of our offices is a partner dentist and 3 associates, but there's always going to be one partner at that clinic. Again, generally owning 50% and then growing that up to an associate. Our goal is to have, in a perfect world with our larger clinics, and we have now 4 or 5 large clinics where there are, 2 to 3 dentists and 5 hygienists running, kind of two dentists at the same time, 4 to 5 hygienists at the same time. So about 8 operatories of production simultaneously.
That's amazing. And not telling you anything you don't know, but when you start to scale to the level that you're describing, it can be really hard to keep hold of the culture. It can be really hard to keep hold of the quality of care. So what strategic things have you guys proactively done in an effort to protect the culture, the quality of care, the standard of care, to the point where it's, I would guess, the same as when you joined your dad, almost 20 years ago, or actually a little bit over 20 years ago?
Yeah. So that's interesting. That's clearly the hardest thing to do, I believe, is try to keep that culture as you grow, because people start to, oh, it used to feel like a family. It doesn't quite feel like, if there's 250 people in the organization, there was when I joined 15 or 20, right? And so it is one of our, I would say, our biggest challenges, but also something that we spend a lot of time doing. And I think that, as you put the time and effort in, you'll reap those rewards. And so one of the things that we do that I think helps us with this is we close each office 3 days a year. So 3 days a year, we close the office to work on the team, to talk up to the team. And we're not talking about dentistry. We're not talking about how to do a better crown prep. We're not talking how to do extractions. We're talking about, how to work with each other better, how to build better relationships, how to make sure our teams are healthy. And so I run a bunch of these, and then we do a bigger one where we get everybody together once a year, and we bring in some other speakers. And again, the speakers are not dental, right? I mean, we had James Nestor. I don't know if you've read the book Breath, but just had he came and spoke to our organization just 2 years ago. What an excellent speaker. Again, we're learning about how to just treat ourselves better and treat our teams better. And so it's one of the things that we've always found is that if we put our team first, we know they'll be able to help the patient. And so we really have to be mindful of how we're treating our teams and how we're building these. And we found with the partners at each office, they're going to take care of their team a little bit better, because if we're running with associates everywhere, not to say, different business models, people do that well. We find that the care is more, hey, what am I making? Because I'm the associate. How do I increase my money that's coming in? But when you're a partner, you consider more of the team and what's going on with the team and how are they functioning. And so my role really is just continuing to be a part of that. Our organization is called Trek, and those are our 4 values. So sometimes I like to just bring that up. Is our first value, T, is teamwork, then respect, then exceptional dentistry, and last, continuous improvement. And we always say our values are written in the order of importance. So teamwork's first, respect second, and dentistry's third. And not that dentistry isn't important. That's what we do. But what I truly believe is, I know even where you are, where we are, there's a dentist on every corner. They can find another dentist to go to. So why are they coming to us? It's not, and I do believe dentists do good work. Generally there's dentists around on every street corner that can do a good crown prep, that can do good fillings. So why are they coming to see you? And I think it's the way you treat the patient and the way you treat the team and that feeling. And that's what people are looking for. They're looking for more than a good filling or a good crown prep. They're looking for a relationship and a healthcare provider that actually cares about them.
Yeah, just so much to unpack there. So you're 100% right. I do think that having boots on the ground, partners in each particular clinic does certainly lends to, certainly it's not easy, but maybe a little bit easier in terms of maintaining that culture and keeping the team member first and foremost. Can you share just some tactical things that you're doing when you get out of one of these all-day retreats? Everyone feels, super energized and great. And yeah, this place cares about me. But then you kind of get back into the, day to day. And, if you're anything like me, things tend to kind of slip back as to how they used to be. So what are you strategically doing in an effort to maintain the momentum that you garner when you come out of one of these sessions?
Okay. Yeah. You have some great questions, because these are the challenges, right? Everybody feels good at the end of the session, and then you're a month in and everybody's like, man, we're just grinding again, right? This is difficult. So a couple of things. One is that we try to create some friendly competitions within each office or within the clinics for health. So health is important to us. So just drinking water, we'll have a water competition. It's hey, focus on, getting steps in, drinking water, doing those things. But one of the interesting things that we've done, and this is 15 years ago, we actually stopped running any sort of metrics out of a clinic. So there's no bonuses at any clinic. There's no doctor's target at any clinic. There's no hygiene target at any clinic. And what we found is our team started understanding that health was the only thing that we were looking at, that we were talking about how to make our patients healthier. And when we got into conversations with the hygienist about what are you producing, health started to disappear. And the conversation is well, are you doing enough prophies or SRPs or scale, and even with our doctors, hey, well, are you producing $3,000, $5,000, $10,000 a day? The focus went to production. And so we actually removed all of that from our conversations. And so at each office, there are no conversations around production. It's just not a conversation that happens. And so when we go in and we see something missing at an office, like, because I mean, ultimately it's still a business, right? I mean, we're running businesses. We need to be productive. Staff needs to make money. But when we see a problem going on at a clinic, the conversation that we then have in terms of how are we going to make our patients healthier and how are we going to keep ourselves healthier changes. So if we see that maybe the hygiene department is not doing as well as it could, there's not as much perio being done in that, we go down and we sit with them and we say, hey, look, have we been doing the probing properly? Are we making sure that our patients are getting that ultimate care that they need, coming in as often as they should be? And when we have that conversation, it's an interesting mind shift for our teams when they're like, man, we're connected with trying to improve health for our patients and our staff. And when we've done that, what we've seen is like actually exponential growth over the last 10 years with the offices as we've removed any sort of metrics. And I know that's like completely counterintuitive to any DSO that's out there. I mean, a DSO without bonuses, right? No targets. I mean, how does that even function? And yet, I'm looking at some of the numbers, talking with Mark recently. I mean, our profitability is higher than most DSOs, even in his organization and across the North America. And so, it's one of those challenges that some of the DSOs say is that, well, if we don't have MBAs that are running numbers and accountants, then what are people doing? And I said, well, when you have dentists running it, we run it a little bit different. And that's a big thing for me, is that who's on top, right? Is the dentist running it ultimately? I mean, we need smart people on the bus, but how are we doing that? And so I know I kind of maybe went down a bit of a rabbit hole on how we're, keeping that momentum going, but our focus is health. And then our focus is health of the team and health of the patient. And that actually keeps us more motivated because we remember our why. Why did we get into this, right? Like I always start with my why. My why is motivating people to live well and give back. And so how can I create healthier team members, healthier patients, and ultimately do more socially responsible work?
Yeah, I mean, you definitely went down a rabbit hole, but it's a rabbit hole that I'd like to continue to pursue, because everything that you just described makes tons of sense in theory. And I'm certainly not going to argue that it's not wildly beneficial, but I'm just curious, because you're right, like you're not a not-for-profit, so someone has to be paying attention to the numbers. I'm
Right.
assuming it's levels of leadership. That the example that you gave regarding a hygienist and perio is a good one. I'll give another example of perhaps one of your clinicians, one of your dentists that's underproducing. At least the numbers suggest they're underproducing, which I would guess that you would then translate it to someone's not treatment planning for optimal health. So I'm just curious, who's identifying that there is a discrepancy? How are they identifying it? And what does the conversation look like from leadership to that associate dentist that's either intentionally or unintentionally not being as proactive from a health perspective as you would like them to be?
Yeah, perfect. So great question. So, I mean, I'll go on the hygiene side and the dental side. Realistically, the numbers are telling us that, right? So ultimately on the management level, we don't have any regional managers. We just have, teams on the ground. Each office has their own team. We don't have any office managers. We call them team leads. And so they're running the clinic there. And then there's a management team of 6 of us that are in the, let's say the office. And interestingly enough, I'm the only dentist there, and there's one accountant that we have on the team. And that's kind of it, that are looking at the numbers. There's only really 2 of us ultimately that are looking at the numbers. He's been in dentistry for 15 plus years. So even though he's an accountant, I would say he's much more than one accountant in terms of what he's kind of able to do. And so, so we would identify the lack of production as a challenge, right? Because I mean, it's hard to see exactly what they're doing, but we can now. And so we are using AI as well on the diagnosis. And so not that we need to pick an AI company. We use one. There's lots of good AI companies out there. But they show kind of lack of diagnosis. So they'll show, hey, we see 10 crowns here, only 4 were diagnosed and only 2 were completed. Okay. What's happening there? So that's how we'll look at it twofold. One, we'll look at the clinical data that we can see through the AI, and then we'll look at the production. We'll say, hey, this person should be at 3 or 5 or 10, whatever that number ends up being in your organization. Hey, they're not quite there. So we need to look at the treatment planning first. So that's where we'll start. We'll sit down and be like, let's pull up your last, 10 new patients. Let's go through and see what's missing here. And so we'll look at the diagnosis first, because we feel that the biggest miss is always diagnosis. It's rarely the ability to do the work. I mean, that's part of it. And can we make their skill set better to go slightly faster? Yes, but if they don't diagnose well, they're not doing the treatment. So it doesn't really matter what's happening on the back end. I mean, our ideal goal is 60 minutes for a crown prep, including freezing, temporization, everything. But some of our docs are at 90 minutes on a crown prep. Okay. Do they have 2 crowns in the day? Right? Because if they have 0 crowns, it doesn't matter how long it takes to do a crown prep. And
Right.
so we will spend the time on that end going through treatment plans with, one of our senior partners, because usually the partners are the ones that are diagnosing slightly better and the associates need the help. That's not always the case. I mean, even partners need help with diagnosing. And I think the AI is helping us even with our partners, because sometimes it's harder to have a conversation with your equal. You're like, hey, you own 50%, I own 50%, but I don't think you're diagnosing very well. That's a bit
Right.
more of a difficult conversation. But when you can see it, when there's kind of almost hard evidence now with AI, it makes that conversation a lot easier.
Yeah, no question. I appreciate that explanation a lot. Before we hit record, you had referenced your new patient experience and how your ultimate vision is to just kind of blow the patient away and really wow them and keep them as a happy and content patient for years to come. Can you unpack a little bit about what your new patient experience is like? And I would be interested to hear, you know, is it easy to get everyone on the same page in agreement to, okay, yes, I'll do it this way, versus I'm sure there's lots of other ideas where they say, well, why don't we do it this way, or why don't we do it that way? Just I would love to hear that.
So our new patient experience is we believe one of the foundations of the organization in terms of how we did it. Dad started it 20 plus years ago, so I didn't come up with this idea, but we always start in a consult room. And so we never take a patient that has come into the office for the first time and put them in an operatory. And there's a couple of reasons why, and I like to bring this back to just biology, but when people walk into a dental office, their anxiety is higher. I mean, nobody wants to be in a dental office. It's an uncomfortable place for 99% of our patients. And especially if they're new to the office, it's an uncomfortable place. So they walk into the office and their anxiety is slightly higher. And then we put them in a dental chair and their anxiety increases even more. And so here's where I go fight or flight. Like, if a bear is chasing you, based on the type of bear that's chasing you, you're either supposed to like drop dead or climb a tree. But you don't have enough time to think. Is it a black bear or a brown bear? Am I supposed to drop dead? Am I supposed to climb a tree? You're just running for your life. And so our brains cannot think when we're in fight or flight. It's really hard for us to listen, and it's really hard for us to think. And so what we do is we take our patients, we put them right into a dental chair and we start talking to them without getting to know them. Their anxiety is high and we're wondering why they're not listening, and we're wondering why they're not comprehending. And then we're talking to them about complex treatment plans and we're wondering why they're not agreeing to complex treatment plans. It's like they're not listening because they can't hear. Not that they don't want to hear, but they're in a state of they're just trying to like get comfortable in a dental chair, and we're explaining a lot of stuff to them. And so where we start is in a consult room to make sure that we're building a relationship first. Spending 5 to 10 minutes just getting to know people, right? Like we didn't hit record the first time we started. Me and you got to know each other for just 5 minutes so that we had a bit of an understanding of where we were going. And so that's where we start with our new patients. We start to get to know them a little bit better. Tell me a little bit about yourself, because it's not about your teeth. I need to know you. I need to know your family. I need to know where you work. I need to know something about you that's going to make you more comfortable in my environment, because I'm here every day. Like the dental office is not anxious for me because I'm the dentist and this is where I work. But for you coming in once, twice, 3, 4 times a year, it's always an anxious environment. And so we're getting to know people outside of a dental chair first, always. And this is with the dentist. It's not with an assistant. It's not with a new patient coordinator or anything like that. The dentist is getting to know the patient first because we do believe that it's a first date. And the first date is the most important part of any relationship, right? You decide in a first date whether there's going to be a second date or not. And a lot of patients, I do believe, are deciding whether they want to come back after the first time they meet you. And so how do we make that relationship something sticky from day one? And so we start there and then we go into the operatory and then we get, the records and do the whole thing. And our process on a new patient experience is an hour with the dentist and then an hour with the hygienist. So if you want to be a patient at any of our offices, you got to come in for 2 hours. It could be two separate appointments if you don't have 2 hours in one day. But if you're not willing to spend 2 hours with us, we're not sure that you're going to be the right patient over the long term, because we're going to spend a lot of time, talking about your health. Like, is there a connection between the mouth and the body? There is. But if I'm doing a new patient exam at the end of a hygiene appointment, how on earth am I building that connection of health, right? How can I talk to them about sleep apnea and their bite and their TMJ issues and all those other things that I need to if I got 10 minutes? And
Right.
so
Right.
we really want to make sure that that's the right way to do it. The other
That's
question that you
awesome.
had is like, how do we make everybody do it? Well, when they start to see the benefit that we have, and when our new patient growth starts to increase, and when you start to see your reviews. And so it's interesting. I told you that we don't monitor any metrics at the clinic. There's only one metric that we actually monitor at the clinic, and it's Google reviews. That's the only metric that they're allowed to track at a clinic level. And so when you see the reviews and you actually see how many of our Google reviews are based on the new patient experience, it starts to make them understand, wait, patients are like, we've never had this experience before at a dental clinic ever. We've never been treated like this. And that's just that kind of like self-fulfilling prophecy of like, you do something and somebody recognizes you for doing it well and they say thank you. You're like, wow, people like this. Maybe I should do it again. And you just keep doing it. And it's kind of, it works itself into being really important.
That's awesome. That's awesome. Let's switch gears a little bit. I did a little bit of research just in trying to figure out how amazing you were, and there's a whole world of information out there on you, outside of being a chairside dentist and owning a quite a successful organization. So I'd love to hear a little bit more about your speaking engagements, and probably even more importantly, some of the work that you're doing for those that are a little less fortunate than the patients that we get to serve on a regular basis.
Awesome. Well, I appreciate that. This is something that, again, when I said, make people live well and give back, this is a big part of my life, and something that I'm very motivated about, because I think that we're super lucky in dentistry. I talk to people all the time and I said, how long have you been unemployed in your career? And it's virtually zero, right? Like dentists, assistants, hygienists, receptionists, we have almost 100% employment rate in dentistry. And that's rare to find in any industry. So we have to start with like, we're pretty lucky. We're pretty lucky to be in the industry we are. And if we're lucky to be in the industry we are, what are we doing to say thank you to society for giving us this opportunity? Because I do believe we're given that opportunity to help people. And that's the reason we got into it. And so for me, a big part of that is turning around the success that we're given as dentists and taking that and turning it into something where we can help others. And so twofold in this. One is, what can we do close to home? And two, can we do away? And so I've done a lot of traveling. I mean, I've done 16 international dental trips, 12 to Guatemala, Peru, Ecuador, Tibet, Morocco. Spent a lot of time overseas helping people do dentistry. And it's amazing how hard you work for free, harder than when you're at home, because there's nobody complaining. Your treatment plan success rate is 100% every single time because they agree, because it's free. Like if you're willing to do it, they're willing to have you do it. And so, I think we're really lucky that way. But those are the things that people look at you and they're like, wow, that was cool. You went to Guatemala. You did all these trips. Like, that's super fun. But what I turn it around is not everybody's willing to jump on a plane and take 10 days out of their life and go to Guatemala or do something like that. And so how can us as dentists make this very easy for our teams at home? And so something we just did, so in May, just last month, and we do this every spring, is we say, who wants to lose 5 or 10 pounds? And everybody's like, well, I want to lose 5 or 10 pounds. And we're like, in your closet. And so we get each one of our staff members to bring 5 or 10 pounds of clothing that they're no longer using, and we bring it into the office. And then we put all that together and we filled a 16-foot truck between all the offices. And we went down to it's called WINS in Calgary, Women's in Needs Shelter. And we delivered they couldn't believe how much stuff came in a day to their shelter, so that they can then give that out to other people that need it. And for us, it's actually rejuvenating to clean your house and get rid of stuff that you're no longer using. But for
Right.
other people, it was amazing what they had. And what was interesting with that is it costs our team nothing. And yet we can help locally. But the coolest part about it is where you start to get that ripple effect. So we'd take these garbage bags and we'd keep them in our waiting rooms. And then we put a little sign, donations for WINS. And so our patients would be like, what are these garbage bags doing in your waiting room? Because we do it the whole month of May. And we're like, oh, these are our donations for this shelter. And guess what happened? Patients went home and they started bringing garbage bags in themselves. They started cleaning out their own closets, bringing it to our office. I mean, one office had a pile so big, like it took over the waiting room. Like there wasn't a lot of room left at the end of the month. It looked a little crazy, but it's that little thing. Like we start with cleaning our own house out and then you get your team members to do it. You got 10, 15 people on your team. Well, now you got 50 to 100 pounds of stuff that you're going to donate, but then you got, 2, 3, 400 patients that are coming in. And if just 1% of those people start to bring in stuff, we got 2, 3, 4 more people bringing in stuff. And it just makes a massive difference. And it's like just something so small can make such a big difference. And this is where I implore dentists. I'm like, think of little things in your community that don't take a lot of time and don't take a lot of effort, but can make a difference. Dentists, usually we have a little more money, a little less time. Our staff, sometimes the money's not necessarily there because, they're making ends meet. So how do we put that together to make something that can help the communities around us?
That's awesome. How long did it take this flywheel to gain momentum in your own organization?
So I don't think like too long. I mean, we grew up, just through your communities. And I think through your, as you grow up and whichever community you kind of associate with, there's always volunteering in, different communities that you're in. It was a big part of how we grew up. And so learning to be a volunteer through the community that I was in, my father was always a volunteer. Volunteering was never like something you were supposed to do. It was just something that was expected of you. So it was never an option. It wasn't like, oh, hey, would you like to? It's like, no, you just always give a little bit back of what you have. And so for us, as we started the organization, as we were working within the organization, it was always something that brought us together, and people recognize us as they're applying. They see what we're doing. And so to us, attracting people now has become easier because people want to be part of an organization that does things for other people, right? I mean, they start listening and they hear about it. They see you online. They see what you're doing. And so to me, it was trying to find easy things and then trying not to do them too often. We got a little carried away in the middle, to be honest. We were doing something like every quarter and then we're like, oh, let's do it monthly. And then it kind of like, it started taxing the whole system. And so we kind of went back to quarterly because, we all want to give as much as we can, but then there's also life that gets in the way and patience. And like, there's only so much you can come up with. And so we're kind of on every 3 months, we try to come up with a plan that makes sense to help others. And then we get people behind it. But one of the things that we do is we try to ask our teams to come up with ideas, because if we as management are always coming up with the ideas, they may not be as passionate about the things that we're passionate about. So we're trying to get them to, and each office can do something completely different. They don't have to do it. It doesn't have to be all offices doing it simultaneously, but it helps. It makes, brings a little bit more community between the offices. But ultimately, all these offices are independently owned and operated. That 50% partner doesn't have anything to do with the partner next doors, right? And so, they can do their own things. And we also, 2% of all of, our profits go into a foundation. And so there's always money going into a foundation that we have money to spend on these initiatives. Because it used to be, we used to ask the partners, hey, how much do you want to put in? Oh, you came up with an initiative this month. How much money are you going to put towards it? Well, now every month we just take out 2%. And so there's this pot of money that when somebody comes up with an idea, nobody has to go, hey, who's funding it? The funding's already there. And so it just makes it easier for the offices to get behind it because we never have to worry about money to fund these initiatives.
Yeah, what a great concept. So I'm sure a lot of our listeners are hearing this and they're probably excited. They're probably in their car thinking like, I want to do this, or I want to get my team to rally around some concepts like this. How could they learn more about like the specific things that you've done or a framework that you might have developed, for someone that's never done something like this? Is there anything out there? Do you have anything, the standard SOP when it comes to getting something like this off the ground? How would some of the listeners just try to model your behavior and be that person in their community, but they don't know where to start?
Yeah, that's an interesting question. So we don't have any documentation or anything like that. I mean, I think the big thing is just sitting down with the team and saying, hey, is there something that is there somebody in the community? Is there a patient of ours? Is there somebody that needs something that we feel passionate about? But like I said, start small. The reason I always give the idea about the cleaning out your place and bringing stuff into the office is that's to me, the simplest one that we do. We do ones that are more complicated. We get to walks and then we go walk for breast cancer awareness. We did one for international development, but that takes people giving their Sunday up or their Saturday up to go and do something. I find those ones we get, the people that are passionate about it show up and the people that aren't don't, which is totally fine. I find those are more complicated. And so I always like to be like, hey, can we start with just bringing in some donations and going to the local charity? Find out, something in your area that needs things and then figure out a way to get them, because I feel like that's the simplest way to start, is to start there. And then it just kind of builds on itself. So kind of two things. That one is like, what do people need around you? Or is there something that you can do? And then also, the one other part is that how do we make sure that we are taking care of ourselves? And so also looking at the team and saying, hey, what's working for you? What's not? And how do we be part of it? And so, dentists, unfortunately, sometimes we're the least healthy people in the office because, we're grinding a lot and there's a lot of hours in a day. And so just looking at little things like water, looking at little things like, what are we bringing into the office for our teams, right? Are you the dentist that brings donuts in once a week? You should probably stop doing
Yeah.
that. What are your specialists giving you? You know what I mean? Like, just being mindful of like, how do we keep ourselves healthy so that we can do this longer? And just asking our teams what they're passionate about, because we need their buy-in. Otherwise it doesn't really work.
Amen. Um, you're obviously a huge wealth of knowledge, and before we hit record, you had referenced that you had some speaking engagements, and you were busy just kind of spreading your magic and your wisdom to different communities throughout the country. If people wanted to get in touch with you, if they wanted to learn a little bit more about your lecturing or your coaching or anything like that, what's the best way for them to dig in?
Yeah. So a couple of things. One, I have a website, so it's just drjanjaffer.com. So it makes it super simple. It's just the name. Finding me on Instagram is probably the easiest way to see the things that we're doing and then come up with ideas. Because if you just go through my feed, you'll be like, oh, look at what they did. Oh, here they did something. So you'll see my kids and you'll see our social responsibility. Those are pretty much the two things that show up on Instagram for me, or find me on LinkedIn. But yeah, Instagram is Dr. Trek. So it's our four values, TREC, Dr.Trek. And then, those are probably the easiest ways to do it. I mean, here's the thing for me, right? I want people to take care of their patients better and take care of their teams better. And if there's anything that I can do to help you, in that's what gets me excited every day, is making sure that we got healthy patients and healthy team members, and we can make a little bit of difference in society and be a little more grateful, because I feel like, in North America, I think we live in some of the best countries in the world here with Canada and the US. I know we can complain about politics and we can complain about the weather and we can complain about all these things, but we're pretty darn lucky to be where we are. And we have so much to be grateful for. And if we can just start with some level of gratitude, we can change the world. We really can. I do believe that with the ability that we have, with our skill sets and the teams that we have, there's a lot of dentists out there. I mean, there's a lot of offices out there. I think we can make things better. We just got to make sure that we're just starting with a little bit of gratitude. We're being a little more grateful than sometimes we feel like, because, we get into the insurance rat race and we get to the PPOs and the HMOs and we're not getting paid enough for stuff. And we can easily go down these deep, dark wells of, hey, this sucks. And it does sometimes. I mean, right? That's the reality of doing that. I like Simon Sinek's, definition of optimism. It's understanding what we're going through now, but looking at the future to be better. So like, stuff can be crappy now. That's okay. But make sure the future looks better than what it is now. And so being optimistic about the future, but still understanding what we're going through today. And so, gratitude helps with that.
Yeah, no doubt. Just a gratitude practice every day, even if it's going to take you 30 seconds, it just completely changes your perspective. Um, and even within your own four walls, like just getting younger assistants, hygienists who maybe you're not as far along the path as you or I are, to understand that, right? To just
Mhm.
understand that, and just take a step back, look through it through this set of sunglasses or this set of glasses, and just be grateful. So I so appreciate the conversation. Really enlightening for me, and now I have yet another person that I have to like look up to and try to compete with in terms of being socially responsible. So now I'm going to be really busy now, just trying to figure out, well, how can I one up him? So, but
Yeah.
I appreciate you bringing the message to our listeners, and I'm going to specifically share this episode with my own team because we're always looking for opportunities to help our neighbor. And I think you hit on a lot of really good ones. And I'm sure we can go to your Instagram page and just see a number of additional great ideas of things that we can do in our own backyard without having to dole out tons of resources financially or otherwise.
Yeah,
So
absolutely.
again, thank you so much for the time. Really, really appreciate it. Look forward to having you on the show again. Ladies and gentlemen, Dr. Jan Jaffer. Thank you. That wraps up another episode of the Dental Lighthouse Podcast. You have a choice today. Choose to be a lighthouse. Lighthouses are powerful and steadfast. They are beacons of light for others to reference when life gets turbulent. Go out into the world today and become a lighthouse for someone. Give more than you get. True joy comes from serving others. Start today. I'm Jason Tenori, your host. Thank you for listening to the Dental Lighthouse Podcast. For more information, podcast show notes, or links to anything that we have discussed today, please check out our website, thedentallighthouse.com. We would love to hear from you. If you would like to get on the show, please email us at podcast@thedentallighthouse.com.